Well, I think technology and the advances that we even see today are going to be here, whether it's artificial intelligence or other new tools that are coming out that are available. I think the reality is that it's not going to go away. And I don't think that's a bad thing. I think that technology really helps us improve our efficiency. And
Mhm.
so my recommendation would be, first of all, to embrace it. I know that it can be challenging because change is hard. Let's be honest, as adults, we tend not to like a lot of change. So my message would be to stay open-minded for clinicians that are especially at the bedside. And then my message for leaders would be making sure that we're listening to the voice of the nurse. You
Mhm.
know, in the academic setting, I teach predominantly at the graduate level. And so I hear a lot from my students about their experiences in the clinical setting. So next, I would say to leaders is to make sure you have your stakeholders, those that are impacted the most, those frontline users, making sure that they're in the room, that they have influence over how decisions are made before
Mhm.
they're actually made. And then you're able to bring them along the journey, that implementation journey, so that hopefully for those that are really struggling with that implementation component, they'll have a cheerleader beside them, or they'll have colleagues in the room that they started the journey with. And so they feel more like they have more buy-in, that we care as leaders because we've listened to their voice. And then the third group of courses are going to be my nurse educator colleagues out there. Let's make sure that we integrate into our curriculum some of the information related to technology. The more our clinicians are able to actually put their hands on the technology, that's going to help decrease their anxiety, and it's going to increase their competence. So when they transition into practice, they feel more ready, they feel more prepared.